Hi, my name is O and I'm from 4 team and our stakeholder is World Health Organization. And I think we should have an extremely lockdown until we can have a vaccine for COVID-19 because I strongly believe that the number of coronavirus cases can decrease by having a lockdown. We know that having a lockdown can save people's lives and it certainly helps prevent a person from spreading the virus to others. So what we have to do is to follow a country lockdown rule, like not going out, staying at home. Like if it's not necessary that you have to go out in order to see the doctors or buy food. This not only protect you from getting the virus, but also to save other people too. According to the Public Health Foundation of India, nearly 78,000 lives have been saved due to the lockdown, and in it and according to Marino Gatto, the professor of ecology at Politecnico di Milano in Italy, says in Italy the lockdown prevented around 200,000 hospitalizations between February 23rd and March 25. Furthermore, a recent study of restrictions in Wuhan, China, found that the city's lockdown on January 23rd prevented tens of thousands of infections throughout the Hubei province. The study also found that without the lockdown, cases in Hubei province would have been 65% higher. And so the early we protect a country in which the government provides an extremely national lockdown, the number of confirmed cases can definitely get lower.
Hello, my name is and our stakeholder is economist. I see your point, but I don't agree with that because I think the extreme lockdown in the COVID-19 pandemic is not solutions because the economy is going into recession for sure, and it also got a huge effect on the country economy. Main income of some country is from tourism such as Thailand, according to Krungsi Research, had reviewed that the effect of COVID-19 pandemic caused a global economy to contract by 3.2% and the ASEAN economy by 2.1 to like 5.4% from normal situation. After the 2-month lockdown, measure is in for Thailand is the most affected among ASEAN member countries as tourists are expected decrease by 60% from last year. The shortage of both domestic and international production chains are a problem that occur. And the result of multiply causing the growth of Thai economy is this year shrink by 5.4%. Moreover, Thailand Business News also state that Thailand has been severely affected by economy, especially tourism sector. Yeah, as I have said at first. And Thailand is not only the country that's being affected by uh, the COVID-19, but overall GDP in the world is continuously decreasing. According to Statista review that GDP in China is decreasing by minus 6.8% in July by the lockdown measure. The BBC also stated that the US economy shrank at 32.9% annual rate between April and June as a country grapple with lockdown and spending cuts back during the pandemic. Do you see the lockdown measure is affecting a lot in terms of economy? It is decreasing. If the government decided to make extreme lockdown of the country, it's obvious that the business or people who work for tourism will suffer with directly effect. It's not only tourism factor, but all of career, yeah, affected if the government decided to do like extreme lockdown. Okay, it might be true that as you said, it might be true as O said that using the extreme lockdown you make people safe, but in contrast the citizen in country will be hard to live their life. They might not be able to work, they might not have like income, they don't have enough money to spend. Yeah, I think the solution to stop already the spreading of COVID-19 until we get the vaccine, yeah, we should use other measures such as always wearing masks when you go outside and do not go into the crowded area. Yeah, there are a lot of people there, you should not go there, and you have to keep or make social distancing. Yeah, and then you should wash your hand with like sanitizer or alcohol gel. Yeah, you might be do like it. I think this is enough to slow down the spreading of COVID-19 until we get the vaccine. We don't need to extreme lockdown the country because it's got a huge effect, as I said. Okay, thank you. That is my point.
Hi, my name is Lalipat Wongsambat. My stakeholder is World Health Organization. I agree with the statement countries should maintain extreme lockdown measures until a vaccine is found for COVID-19. As social distancing lowers the number of people that can get infected, while lockdown matters because traveling could bring the virus into the country. CNN News shows the wider impact in cutting infections by reducing contact. According to Business Insider website, an expert says countries may need to impose new lockdowns every 3 months until a coronavirus vaccine is available. In January, China put 60 million residents on lockdown to slow the spread of coronavirus. Residents were not allowed out of their homes. The city was shut down, and public transit and private car travel were stopped. Then, after 2 months, China's coronavirus epidemic finally ends. It's clear now why countries have to maintain lockdown measures because it works in China. And this is my point. Thank you.
As regards to countries' economies, I feel like to have a shutdown is not the best idea we have here, since we can still live our lives normally as we did before. But this time we have to, practice social distancing and some regulations in order to stop the spread of the coronavirus. And with this method, we can stop the spread of coronavirus and at the same time doesn't put our economies at risk. And I think this could be one of the best alternatives we have here, because the goal is to stop the spread of the coronavirus. So to see whether or not a method or a way works should be judged by the decreased number of new confirmed cases. And I feel like to have a shutdown is a little bit too much, because of course it can help stop the spread of the coronavirus, but what about people's well-being in terms of financial state? So we have to kind of balance this. And though people don't die because of COVID-19, they will die because they have no money and no jobs anyway. I'm not being exaggerating. That is kind of true. That's why people are coming out for protests. That's why I think we should keep our normal lives going, but have to practice some rules, and those rules are, as you guys know, sanitize your hand, wear a mask, practice social distancing, and be hygienic. Take care of your hygiene. So the decreased number of cases should be the only measurement we have in order to judge if a method works or not. According to statistic data of COVID-19, Sweden, despite the fact of never having a lockdown before, Sweden is doing a pretty good job in decreasing the new confirmed cases. But if we go back to July, which was when the COVID-19 was widely spread, I think, the highest number, the highest new confirmed case was almost 1,700. Yet the government did not shut down the country, did not have a shutdown. Surprisingly, the new confirmed cases kept decreasing, like the number of people getting COVID-19 kept decreasing until now, September 18. Number is not even 200, let's say. So this shows that, just to live our lives normally with some social rules, with some social distancing and regulations can help stop the spread of the coronavirus. And you might say, people don't follow the rule. Well, that's true. That means they do not love themselves and people around them. If they were infected with COVID-19, of course they were asking for it. And trust me, responsible people know what to do. So I feel like if we have the best alternative here, that can decrease the new confirmed cases and doesn't, worsen our economy. What are we waiting for? That's why I think to live our lives normally with some regulations, with some rules, is better than having a shutdown. Thank you.
Hi, I'm Min. I'm from 14, and I believe that if country leaves lockdown, it will increase the number of infected people, which make hospital cannot handle the high amount of cases. So countries should maintain extreme lockdown measures until a vaccine is found for COVID-19. According to Dr. Deraramjay Thakipur, a preventive medicine resident at Johns Hopkins Bloomberg School of Public Health, in the first level infection, the hospital still handles the high amount of cases, but in the second level infections, hospital may be unable to keep up with the increased demand for patient care needs. In this case, space, staff, or supply elements can be overrun. Then some people are unable to receive treatment, and treatment equipment doesn't have enough for the patients. In the absence of medication of vaccination, the avoidance of certain human interaction is really the only way to stop the spread of the virus. Essentially, the fewer people are in contact with each other, the less the virus can spread. And experts from the Indian Council of Medical Research said that one COVID-19 infected person can spread the virus to more than 400 people in about 30 days. Now, think of the time when all the 12,000 COVID-19 infected patients were not quarantined and were out roaming in the open in the country. The virus would have spread like a wildfire. It can break the chains of the infections. So how soon we can lift the lockdown is really in our hands. So that is all my point. Thank you.
Good morning, teacher. My name is Prao, and my stakeholder is economists. So I believe that countries should not maintain extreme lockdown measure until the vaccine is found for COVID-19, because we can confront COVID-19 better than stay in the starvation from a poor economy. Lockdown is the way that government control entry and exit in the country, including domestic agriculture. So it affects people's normal life, such as lockdown causes people to have to work from home to prevent infection. And the worst case is some people lose their job due to the pandemic effect on company lack of income. It means that people who lose their job might suffer from the cost burden and losing financial liquidity. Some businesses were bankrupt. According to the National Labor Organization, they show that 15 million domestic workers are significant impact from COVID-19. It can be true that domestic workers who were in lockdown and who were not previously registered to Social Security were considered to be at higher risk of losing their job and income. Therefore, the remedy from the government cannot help everyone. People who have low technology can access to register for Social Security. It means those people still suffer from infected Covid-19, which have the patient sick from this virus can recover from the infections by not waiting for any vaccine. Conversely, if we were patients with the poor economy, waiting for the vaccine, no work, no money, we would exactly stay safe, but starving as well due to the lack of income. It seems like these are the biggest problem which no one wants to encounter. That's all my point. Thank you.
Hi, my name is Deshini Waitian, and I agree with statement that countries should maintain extreme lockdown, make sure our vaccine is found for COVID-19. It is true that lockdown affect two country economy stop, but we should protect ourselves to not infect with coronavirus for economic in country are exist. If we infect with the virus, who gonna sell or buy goods, and what gonna happen with economic in our country? Due to the unavailability of a vaccine and the high degree of contagiousness, social distancing is perhaps the only way left to fight the virus, which has forced more than half of the human population to stay at home to stay safe. The virus is smaller than and travel in the air, even longer distance. While we stay at home, EU data reveals that the transmission of influenza almost vanished across Europe between late March and April, with around half the number of people requiring intensive care treatment compared to the previous 2 months. So, if it's not locked down, if it's not on lockdown, what is going on? And we can do whatever we want, but then we will infect with COVID-19, right? And I suggest that if you don't want a country economy stop, online market is the best way in this situation. Thank you.